what we have developed is a 10-week workshop, all somatic experience based. And it's to help to what we're trying to ultimately do is to see how somatic experiencing in a group setting is impacting these clients that have been through treatment and are still working on their recovery and their development. And we're looking at things like how their quality of life is improved, if they're noticing a decrease in symptoms of anxiety or depression. We're looking to see how somatic experiencing is helping them to connect with themselves, create a deeper relationship with themselves, a more embodied relationship, and ultimately to look at how they're connecting differently in the world at the end of the study.
So somatic experiencing has the research base is growing on this, but nobody has quite studied it yet for eating disorders specifically. And what I think is super powerful about the relationship here is that eating disorders, there's a huge focus on the body itself. And in many instances, there's a big disconnection from the body. Historically, people have typically looked at, researchers have looked at body image. For instance, like what do women see when they look in the mirror, or men, whoever, and what is that interaction and how is that kind of shaping their eating patterns? And new research is starting to question, is it not just the appearance that we see in the mirror, but it's how we feel in our bodies that also can affect our patterns of eating, all sorts of things like that. And so what's really interesting about somatic experiencing in particular is that it's focused on bringing the individual back into their body, to experience their body as safe, to feel authentic in who they are. And people who have eating disorders typically don't feel very comfortable with those things. So we're hoping that somatic experiencing will be able to help these women be able to feel more at home with who they are, to really be able to be themselves and to ultimately start moving towards a healthier lifestyle where they take active care of themselves and really learn to love themselves.
One of the things that we know with eating disordered patients, I'd say about 99.9% of the patients that I've worked with have all experienced chronic stress and trauma in their childhoods. And what happens in that process is that most of them don't or have never been able to have what I would say safe relationships where they feel like they can fully be themselves. And a lot of these patients very early on start to use food as their primary relationship in a place where they feel safe. So part of the work in this study is for us to help to build that safety in their bodies and reconnect in a way that puts food in its appropriate place relationally. Once we see the impact of this study on the eating disorder population, we can then I think it's maybe there's a couple of layers and levels that we're trying to look at. We'd like to roll this out on a bigger scale to other eating disorder clinics nationally. We're also developing a protocol for group somatic experiencing, which is different than the individual work, because part of it is it's not just relationally with the therapist. It also creates a relationship with other group members and connection and more cohesiveness within a group, and which most of these individuals don't have. Most of them live fairly isolated and disconnected. So I think that's the first thing. And then we've talked about rolling it out to other populations and really developing, it's more of a manual-based protocol for somatic experiencing, which is not available right now.
And what's really interesting about this is, typically a person goes, if they're having some sort of problems, they hopefully go see a therapist or go see someone to get help. And often the focus is on like, let's nail down the diagnosis. What specifically, what are your specific symptoms? How does that cohere into, how do those all add up into, syndromes or different behavioral disorders, et cetera. And that's important. But for the individual, it's important for a lot of different reasons. But for the individual who's suffering on a day-to-day basis, the diagnosis, the DSM, the things that therapists and psychologists use are less important to the individual. What matters to them is how they feel on a day-to-day basis. And what's interesting is that, you can have two different people and they might have the exact same feelings and sensations in their body due to, past trauma, chronic stress, et cetera. And one person tends towards eating disorders and the other person, for instance, maybe goes towards alcohol. A third person might, go use sex inappropriately. And it's not a problem of the thing itself. There's nothing wrong with eating. There's nothing wrong with sex. There's nothing wrong with alcohol, given the appropriate constraints. And so eating disorders are just one manifestation that someone who's had a lifetime of trauma or traumatic experiences, it might manifest that way for one person, but someone else can have a very similar background and it can, lead to any other sorts of addictions. And so the addiction is less, it's less about the thing itself, whether it's the sex or the eating or the gambling or, even binge watching TV, right? People will abuse. So it's really about how do we create having a healthy relationship with these substances or these experiences, and that healthy relationship starts within. And so that's through somatic experiencing. If we can reconnect to ourselves on a really deep level. And for many of us, it's really connecting for the first time ever sometimes. And so when we have that sense of wholeness within ourselves, you can go out and have a drink, or you can go out and, go to a buffet, or you can,
right.
Engage in.
Yeah. And once we know that this works with a maladaptive behavior, such as an eating disorder, we can take it into other populations.
Exactly.
I think that's really the big piece.